work in King's College Hospital, which provides comprehensive services in epilepsy. And one of those services is what's called video EEG monitoring, which is undertaken on the epilepsy monitoring unit. The purpose of video EEG monitoring is to try to catch a seizure while the person is in hospital, and then to look at the video and the EEG, which is the electrical brainwave recording, to understand how that seizure arises, where in the brain, what kind of seizure it is, and that helps us refine treatment. Quite a few years ago, we became aware that video EEG services in hospital were in very short supply, and there were quite long waits. So some of my clinical colleagues saw a need and an opportunity to provide these services actually in the patient's home and take the monitoring equipment out to the patient's home. And I became involved in that to formally evaluate the diagnostic accuracy and acceptability of doing video EEG at home versus doing it in hospital. And we found that it was acceptable to patients, it was preferable to patients, it was acceptable to clinicians, and the information that we got had a very similar diagnostic value to the information we got in hospital. And moreover, it was cheaper. So it was an approach that everybody was very happy with. And we then implemented this as very much our routine for video EEG monitoring, to do it in the patient's home rather than in the hospital. And as we got going on this service, we became aware of a commercial provider in Australia called Seer Medical, who were doing this in a very innovative and evidently successful way. And again, we became aware that one of the leads of that was Dr. Dean Freestone. And we started discussing with him how he was building his service, how he was providing his services at home. And we learned a great deal from him that helped us provide and optimize our service from King's.
Hello, I'm Dean Freestone. I'm the CEO and co-founder of Seer. Seer is a medical technology company that's focused on helping people with epilepsy. We do so by translating clinical grade monitoring that's traditionally done in a hospital environment to the home environment to make care more accessible and equitable. So how did we get here? Well, prior to co-founding Seer, I had a 10-year research career that was focused on doing R&D with implantable devices inside the human brain that could continuously record information. And the idea is that we'd use this data to try and forecast seizures in advance and come up with ways of using electrical stimulation to try and prevent those seizures. Now, this research closely paralleled and was inspired by the work of Professor Richardson at King's College. And we collaborated together and we talked a lot about appropriate techniques here, and we really pushed the field forward together. Now, one of the things that we realized in doing this research was the challenges in dealing with the vast amounts of data that these devices could generate. We realized that desktop computing was no longer appropriate and we needed to think differently. We needed to think about getting the data to the cloud and using AI. So mobile networks, cloud computing, and machine learning became very important. And to build these technologies was the reason why we started Seer. So where are we at today? Well, right now, Seer and King's are working together on a project that's funded by the American Epilepsy Foundation called My Seizure Gauge in collaboration with Mayo Clinic.
And the purpose of My Seizure Gauge is to develop a process and a system that would give a real-time continuous indication to a person with epilepsy about their current risk of having a seizure in the next period of time. So quite simply, some kind of gauge or visual feedback on a mobile phone that they could look at any time and would provide that estimate of seizure likelihood. And the information that we use to infer seizure likelihood is partly from a seizure diary that the patient might keep. And we're finding that that can be refined and improved using various kinds of wearable sensors, such as a simple fitness smartwatch or an implantable subcutaneous EEG system. And by combining diaries and sensors, we're now a long way towards having a real-time working seizure gauge that people with epilepsy can use. And we see that as really an enormous step forward in patient empowerment and improving patient safety and moving towards really very different ways of treating epilepsy, when we would focus treatment on times of highest risk rather than treat people with epilepsy continuously. I'm very excited about the future and what we can do next. And based on our joint experiences of providing video EEG services at home and developing the seizure gauge, the future that I can see is a seamless, comprehensive, innovative digital ecosystem that spans from formal medical diagnostics, so the kind of video EEG that we've been doing, right through to patient-facing apps and seizure gauges that allow us to provide a seamless set of remote monitoring modalities. And what I envisage that would provide is an individualized approach to epilepsy management that would be as close to home as possible, in the patient's own home, in their real life, as they're getting on with their day-to-day activities. And that information would empower patients to maximize their safety, refine their treatment optimally. And then that would result in a geographically highly equitable way of optimally managing epilepsy. It wouldn't matter whether you were close to your GP or close to the hospital. We could still provide that excellent innovative service to patients. So I'm very excited to see how that will develop over the next period of time. And I'm sure we will be working very closely and very hard with Dean and his colleagues to refine those services and build that future aspiration.